Here in the Assembly, just yesterday, global health ministers agreed on a brand new resolution to take actions in countries. And also this year in September, heads of states will be convening in New York in the UN General Assembly on antimicrobial resistance. And with this background, let's talk about what AMR is and what is being done to respond to this. During the conversation, please let us know about questions that you would like to ask from our panel. And I'd like to introduce my panel. Vanessa Carter from South Africa. She's one of the lead advocates representing people with lived experience. She is the chair of the WHO task force of AMR survivors. And Dr. Sujit Chandi, Executive Director of International Center for AMR Solutions, global organization headquartered in Denmark. And we have Dr. Silvia Bertagnollo, who is the head of surveillance, evidence, and laboratory strengthening with the AMR division of the WHO. Welcome to the show. So I'd like to start the conversation by asking a question from you, Vanessa. You're one of the millions of survivors of people living with AMR, and perhaps you can share your story with us. How did it start with you, how it was like, and what kind of support and you received from your community, from your health workers?
Thank you so much for having me. So in 2004, when I was 25 years old, I had a car accident in Johannesburg, South Africa. And I was left with many, many injuries to my abdomen, to my neck, my back, and to my face. I was also left partially blind, so you'll see I have an artificial eye. And even though I had to survive in hospital, overcoming the extensive injuries, the worst were to my face because I needed to have different prosthetics implanted. And so in my 6th year of prosthetics, I had an infection appear. And so we had to do a surgery to clean the prosthetic, but 2 weeks later the infection came back again. And so we did the surgery again, and 2 weeks later the infection came back again. So for some reason the antibiotics just didn't seem to want to work, and neither did the surgeries. So they removed the prosthetic, and a year later we tried to fix the damage because I'd now lost huge portions of my face from infection. And we did that, but then the infection came back again, this time on the skin and bone. We then took end-of-the-line antibiotics, so, sort of last resort antibiotics for about 4 months. And finally the infection cleared. So it was a very long time. It was 3 years of fighting recurring infections. For me it was just a case of thinking, you think antibiotics would work, but, in my case it didn't.
And you are now leading up the WHO task force of AMR survivors. And recently you launched a very powerful campaign that is about AMR is invisible, but I am not. Could you tell us why did you decide to join the campaign?
It's extremely important that, because I think, the people behind AMR, AMR is we don't see AMR around us, but there are so many millions of people that are impacted by it. And I think that's why the slogan, AMR is invisible, I am not, is so powerful. Because I am not the only person that is impacted. As I said, we've got the statistics there, we've got the numbers, but we need to be listening more to the actual people and the stories of what is behind the statistics.
So I'd like to turn to you, Silvia, as you're leading the global AMR surveillance here at the WHO. Is AMR truly invisible, or how is it known or understood in countries? Do we have the right data?
Thank you. I think it's important for us to do a step back and discuss what is AMR really. Because AMR sometimes is an acronym that we understand among us, but maybe for the general public, AMR is not so straightforward as a term. So antimicrobial resistance that we call AMR is really a phenomenon that is characterized by the fact that bugs, viruses, bacteria, parasites, fungi escape the effect of medicine used to treat them. And so when they become resistant to medicine, it means that medicine don't work anymore, cannot treat the infection for which they are given. And so this is problematic because it's associated with an increased morbidity, it's increased mortality, it's increased health cost, and is a problem that each of us experience. Is experienced by in low middle income settings, experienced in high income countries, is experienced by younger population, elderly. So it's a global problem, and we need to really act together to address it. So we do see mortality. 1.3%, 1.3 million people die every year of infections that are resistant, bacterial infections that are resistant to antibiotics. And this is a big number, and this number is expected to increase over the next years. We have seen that there are projections that suggest that resistance is likely to double between 2005 and 2035, particularly to the antibiotics that are used to treat very resistant infections, what we call reserve antibiotics. So yes, it is a global problem, it is a global threat that requires our collective action.
I'd like to turn to Dr. Sujit, to you. This is a global threat, and you are a doctor, researcher, and your organization is working in so many different countries and communities. And you've been involved in this work for many, many years, raising the alarm from the early days. But as a doctor yourself working with patients, how did you see AMR, and how was it like in the early days?
I must confess that actually, after my MBBS was over at Christian Medical College, Vellore, which is in southern India, the first patient I was allotted as a fresh intern was a lady, and I still remember that room. As soon as I entered the room, the smell was awful, and I was wondering why there's such a smell in this room. And then I realized this lady who was pregnant and expecting a delivery had an infection. And that infection was really causing so much of sickness in her. And that infection was causing the smell. And then for 10 days, I took care of her. But then I realized that the world is not as ideal as one sees when you learn medicine. And the antibiotics were just not working to treat that infection. And finally, we lost 2 lives after 12 days. The 2 lives, one, the lady, and the unborn child. And that struck my heart that, yes, antibiotics are a miracle in one sense when it was discovered. But now we're reaching a stage where the antibiotics are just not working. And therefore it becomes a real person's crisis.
In which year was that, if I may ask?
1991.
And that would be so many years ago now.
That was so many years ago. Which means, and as Fleming also said, the more we use antibiotics, the more the bacteria and other microorganisms will try to fight back and survive themselves. So it made me realize that we need to use antibiotics wisely and appropriately so that we preserve the common good for those who really need it.
Before asking next questions, I'd like to turn to some of the questions we are receiving from our global audience on social media platforms. And I have a question that came to us via Facebook from Suleiman, who asks, can you brief us on the status of global research on AMR? I may start with you, Sylvia, with this question.
Thank you. Thank you for this question from the public. So we are one of the pillars of that WHO is really pushing forward is about research and innovation, because clearly we need more antibiotics, we need more rapid diagnostics that are available at the level of the patients so that diagnosis can be done quickly. And WHO has pushed forward a global AMR research agenda. What is the global AMR research agenda? It's a list of 40 research topics that we feel collectively There was a very comprehensive consultation. We feel that are the most urgent and important that needs to be addressed between now and 2030. So these 40 research topics, and I invite you to look on the WHO webpage, is available. 7 of them are related to drug-resistant TB, and 33 are related to resistance in bacteria. And this concern the patient journey, because always it's important to bring the patient perspective and the people perspective. So start from the prevention. So what are the research topics on immunization? What are research topics on water and sanitation, on infection prevention and control? Move to the diagnosis. What are the key research questions on the diagnosis of bacterial infection and fungal infection? And then move to the treatment. What are the most urgent and pressing research questions on treatment and care related to bacterial infection and resistant infection? And then there are some cross-cutting themes like surveillance and strategic information and policy changes, and in terms of behavioral changes that also needs to be addressed.
Thank you for that. And next question is also from Danjuma Jibrin, who's watching us on Facebook, asking, can you tell us more about antibiotics misuse? I was going to ask you, Vanessa, about actually people and lessons learned and what can we do ourselves individually, but also maybe you can speak about different misuse of antibiotics that could be contributing to AMR.
Yeah, sure. So, obviously, whenever I speak about this, I speak from a patient perspective. But, as a patient, I learned too late that, for example, I shouldn't be, asking for antibiotics for the wrong reasons, because when we take them, for example, for viruses, they don't actually work. The other thing that I was also learned was, strict infection prevention care, to manage my infection at the time, and that made a huge difference. So in other words, washing my hands all the time, and also asking my doctors to wash their hands before they worked on me. So I think, patients are so crucial to the antimicrobial resistance puzzle. And again, to use, making sure that we also adhere to our antibiotics correctly. Yeah.
And in fact, many of us, all of us, are often not aware that we might be misusing antibiotics and that might be contributing to this overall problem that we are talking about here. That is one of the key issues. But I also wanted to ask you, Sylvia, because you've just recently published a major study together with many authors which talked about the antibiotic overuse during the COVID-19 pandemic, and major new data has been released. It may not be about individual misuse, but indeed it is a broader problem. And could you please talk about that?
Yes, no, that is an important work that has been published in collaboration with many other, and this is reflect the analysis of the global AMR clinical platform, global COVID clinical platform, which is the platform that collects individual level data of patients hospitalized around the globe from 65 countries. And over 1 million patients data were reported to WHO. What we observed is that 3 patients with COVID out of 4 receive antibiotics. Now, we know that COVID-19 is a disease caused by SARS-CoV-2. SARS-CoV-2 is a virus. And we know that infections caused by viruses do not benefit from the use of antibiotics. And yet, 75% of patients hospitalized with COVID receive antibiotics, which are not working for viral diseases, viral infections. And so this is alarming because highlights that antibiotics are utilized, that there is an overuse of antibiotics in patients that don't need them. And when a patient does not need antibiotic, the risk outweighs the benefit. And there are some risks associated with antibiotics, as any other medicine in general. Risk for the patient associated with side effects, allergies, gastrointestinal side effect, as well as resistance, both at the patient level and at the population level.
Thank you for that. We have another question from Satish George, who asked, how do vaccines play a role in preventing AMR? I wonder if Dr. Sujit, you could share your thoughts on this.
I think we need to realize that preventive strategies are very, very important. We know that AMR is an issue of sustainable access to effective antibiotics, but we also know that our health infrastructure, our societal infrastructure all play a part, because it is no longer just a microbiological issue. It is truly a socioeconomic, a behavioral, even an economic issue. And therefore, prevention becomes extremely important. And vaccines is one of the really good ways, besides hygiene and washing hands, those kind of things. So vaccines become very important, especially in today's world where we realize that some areas just don't have water resources, don't have many things where in the global north, for example, we take for granted in terms of hygiene and structural issues. So therefore vaccines become crucial, especially in the vulnerable age groups, children, elderly, or those with other diseases like diabetes, where your chance and risk of infections become huge. And therefore, much more research and development needs to be done on vaccines. We've done a lot, but we definitely need to do much more.
Thank you for that. We have another question from Rohit Pandit, who's asking, do we have any guidelines on antibiotic use?
I would like to respond to that, because yes, we do have a guidance which we call AWARE book. AWARE book is a very important book that WHO has produced, and really support member state and providers, healthcare providers, on the rational utilization of antibiotics for infection syndromes. So it provides guidance on what antibiotic needs to be accessible and needs to be watched with carefully, and then reserved for infections that are caused by resistance pathogens and needs to be then kept more carefully and used only when necessarily. So this guidance, which is called AWARE, is AWARE book, and again I invite everybody to have a look, is really important, because provide that rational information on how to utilize effectively antibiotics.
Particularly for patients, it would be very important, wouldn't it, to really discuss with their doctors about the rational and proper use of antibiotics and following the regimen, so that it's not misused or overused. So now I'd like to move the conversation a little bit to the future. This is a very critical year for AMR, historic year, I might say, because we just had a major resolution at the World Health Assembly yesterday, in fact. And then going forward in September, we are going to see heads of states from around the world really discussing AMR and what should be the priority actions for the next decade or more. So I'd like to learn from you, Vanessa. What do you think, from the survivors or the patients' perspective, what are the expectations? What would you like high-level meeting decide for you?
I think very, very important is that we have participatory, inclusive approaches to everything. I mean, the WHO Task Force of AMR Survivors have just completed a strategic guidance document on meaningful patient engagement, and that would go across the board, not just in the actual implementation of the NAPs, but also in awareness raising, because by including patient stories, you break down the science of AMR. So it's so crucial that we do that. And also medical education. For example, I've shared my story with some nurses and doctors in the antibiotic stewardship teams, which really helps them to understand why they do the work that they do. So that's only 3 examples. So again, to answer that question, think about, what is the purpose of involving patients, and also why is it so important? We need to be. When you talk to somebody on most occasions, a member of the public, and you say to them, "What is AMR?" they don't know. And this is something that we need to be changing and taking very seriously because we are key stakeholders. Yeah.
Indeed, if you go out in the street and ask people, do you have AMR? Do you know about AMR? We wonder how many people will be able to respond to that question, isn't it? So my next question also about looking forward, I'd like to ask of you, Dr. Sujit, you work to develop solutions to AMR, which is very important, and you work with countries and communities who are really at the front lines of these issues. From your perspective, what are the really top, I want to call it easy wins, but what are the top things that we can address, and what are the key solutions that we need to bring to the communities?
Thank you very much. Yes, at ICAS, the International Center for Antimicrobial Resistance Solutions in Denmark, where we realized that if you really need to move forward with the national action plans on AMR, we need to have a top-down, bottoms-up approach where we involve the government, research institutions, all the sectoral professionals, but also the community. And we realized this because if you really want solutions to work on the ground, we need to understand the community, the challenges that they have in whatever strategies we are developing or the solutions, but make sure that they are cost effective and they're sustainable, and that there is an adoption, that they believe in it. So what we're doing across the sectors is, for example, in Kyrgyzstan, where they're looking at a lot of antibiotic use was in small children with upper respiratory infections, and most of it is viral. So therefore, how could we reduce that antibiotic use and make sure that we sustain the effective antibiotics? And we introduced a small test which allowed the parents and the doctors to rely on that cost-effective test and say, okay, let's do the test first and let's avoid the antibiotic unless absolutely needed. And secondly, in Georgia, for example, where antibiotics were being given for surgery at one point in some hospitals. But then we introduced a kind of a policy which got adopted now in the National Action Plan. So trying to get these cost-effective solutions is what we're trying to do across the sectors. And we're seeing that it is working now, where again governments and the community and the professionals start believing in it.
Thank you for that. But in fact, one of the members of the audience is thinking exactly like you and asking a question, and you may elaborate on it. She's a nurse. Her name is Difon. She's asking, what are in terms of access of the public to the antibiotics, are there any strategies to reduce public access to antibiotic use in developing countries? What are the regulations that need to be in place?
I think this is a very important question because we need to realize that the world is different. Regions, settings are different. Primary care versus tertiary care, rural versus urban, government versus private, all have different challenges. We also need to understand that 95% of the bacteria or more are good bacteria, which actually help us in our body. But each time we take an antibiotic, we're actually probably destroying some of those good bacteria and leaving back some of those bad bacteria which multiply. The second aspect is therefore, many of the time when we actually need, to have a good, effective antibiotic, most of the time there's no antibiotic available in a pharmacy shop or at the hospital in many of these poorer settings, resource constraints. So access versus excess is a big issue. If we totally regulate antibiotic use, and then there's a huge access issue and people may actually die because there's no antibiotic. So that balance is critical whenever you're making regulations and policies. And that will help make sure that those who need the antibiotic get the antibiotic, but those who are overusing or misusing the antibiotic need to be made aware through good stewardship and other practices in farms that let's not use that antibiotic.
Thank you very much for that. So, as we look forward to September, UN high-level meeting on AMR, we really believe that this will generate a new phase of action globally and really help to reduce the threat of AMR globally and make health for the people a little bit safer and protect us against AMR. I'd like to seek your opinion, Sylvia. What are the main issues that are addressed in the draft resolution? I know countries have been negotiating about the resolution already. What are the key things that we should expect in this next political declaration that we would see?
Thank you. And I think today we are very happy because the resolution has been adopted by member states. It's an important resolution for antimicrobial resistance because is the first step, is not the first step, but is one important step towards the UNGA, UN General Assembly in New York in September, when the political declaration will be discussed and hopefully will include important information that will help us to move forward, including targets so that improve accountability of member states in doing action, concrete action towards something that is a number and can be achievable. And we have examples from many other disease areas where targets help very much in moving a government to make concrete steps and financing action and activity in order to limit and mitigate antimicrobial resistance. So in this resolution that was approved today, there are important components. First of all, it is expected that now countries and government are fully engaged in the preparation of the high-level meeting in New York that is happening in September, when the political declaration will be established. So the political commitment is key. The second important component is related to prioritization. AMR is a very complex phenomenon that have multiple activity and is intersected sectors that play an important role in mitigating AMR. So having clear action point that member states can implement is important. WHO has put forward 4 strategic priorities. One is related to prevention of antimicrobial resistance through the implementation of water and sanitation measure intervention, through the implementation of infection prevention and control intervention, through the increased implementation of vaccination. The second strategic priority is about increasing access. As Sujit was saying before, we have a problem with access to antibiotics, access to diagnostics, access to vaccine. For example, access to diagnostic is a problem. In African settings, for example, there was a recent study that was published. Only 1.3% of clinical laboratories have capacity to do to diagnose bacterial infection. This is not acceptable, and this is clearly result in the utilization of antibiotic without having test result in hand and susceptibility testing in hand. The third strategic objective is related to the strategic information, in strengthen surveillance, strengthen data that can inform policy at the national level to inform treatment guidelines, rational treatment guidelines that are evidence-based, as well as the local level. Surveillance is critical to inform IPC intervention, understanding whether there is an outbreak at the hospital level, understanding whether patients are carrying bacteria, resistance bacteria, and therefore necessitate to be isolated so that there is not a further spread of resistance within the hospital setting. And then surveillance is critical also for informing stewardship intervention, informing the rational utilization of antibiotics, the exact antibiotic to the right patient with the right duration and the right dose at the right time. So this is all based on informed by surveillance data. And then research and innovation is part of the third strategic objective. We need to have better antibiotics, new antibiotics. We need to move ahead with the research on vaccine and having diagnostic that are rapid diagnostic, close to the patient, easy to understand. And lastly is about effective governance and financing. We need national action plans that are financed, that are sustainable, and then can be implemented with the budget that is available at the country level. And we need a country coordinating mechanism by which the multiple sectors that are involved in resistance meet and discuss priority action and move jointly.
Thank you very much, Sylvia. So we got a bit of a sneak peek of the political resolution. There's so much to be done, that is to say, and all of this needs to be done in every country, and there's all of us need to engage. And I have one last question to all of you, but before that I want to also acknowledge thousands of people who are interested in this topic and tuning to our conversation, and I'd like to mention that they are from countries like Germany, India, Bangladesh, Nepal, Sri Lanka, USA, the Philippines, Canada, Indonesia, Thailand, Switzerland, Pakistan, Spain, Nigeria, Ghana, and many, many more. Thank you so much for joining. But one last question to all of you. All of this will require funding. There will be the political commitment, but also lots of funding. What's your view in that? Will we be able to mobilize that funding to accomplish all of the actions that Sylvia's just outlined? Let me start with you, Vanessa.
Yeah, I think, coming again from my perspective, I mean, I think that community actors, patient advocates, charities, they are very, very important to contributing towards the action that we take on the political declaration and national action plans. So funding is really, I think mobilising funding for them is really key, because I think that then, we talk about taking a societal approach, but we can't do that without involving all of society, and so for me, they are really key stakeholders to be mobilising funding for.
Thank you, Suji.
I think generally AMR is a development issue for the world. It is a systems issue where whether it's a farm or whether it's a hospital, how can we maintain good infrastructure so that things can be done properly? So the governments therefore can improve that because they do have the mandate and the budget to do that. But beyond that, specifically, we must remember that any society, not just for survival, but to improve their daily lives, health and education are important. So if they invest in that, that itself is good. But really speaking, to get those strategies right, especially in resource-constrained, low-middle-income settings, we need to find the real evidence out there, the contextual evidence. What are those cost-effective solutions? And the only one of the ways, really, is to look at this lens through intervention and implementation science. And once they know that it works with this amount of money rather than this much, yes, the political buy-in, the commitment will be there. Let's invest in this. Let's invest in AMR.
Thank you. Sylvia?
No, I would agree with my colleagues. We need political commitment, and political commitment means also, creating a budget that can support and finance the priority activities that the government has put forward. So clearly, government needs to stand up and finance AMR, finance the fight against antimicrobial resistance, and as well, of course, we need to have better access to available funding sources that maybe are not fully visible to countries, are not maybe clearly visible, such as, for example, the pandemic fund, such as, for example, the global fund that support antimicrobial resistance for the three disease areas, HIV, malaria, and tuberculosis, but as well support health system strengthening, which include also strengthening laboratories, strengthening surveillance systems, and AMR can benefit from that component. So I think both components making streamline of international health more visible, and so that country can apply and use those the resources, as well as increase internal financing, national financings for AMR.
Thank you very much. Discussing this really timely global health topic that is AMR, antimicrobial resistance today. Thank you, Vanessa Carter. Thank you, Suji Chandi, and thank you, Sylvia Bertagnolio, who joined us today. And thank you to all of you. We will see you again at our next Social Life conversation.
I mean,